So let's look at healthcare lead generation. And if you've had some awkward conversations around it, maybe it's time to inspect what it means and why there would be awkwardness around this topic. Now, as a doctor, it is a fact that when you operate a private or an independent health practice, you are wearing a business hat. Maybe not all of the time, and hopefully not all of the time, but occasionally you'll just sit back and go, well, hey, I am actually running a business, my private practice. So lead generation sits in that corner, in that basket. You do have that business hat, and when you put it on, it's good to be really aware that you are now working on your business, on your practice, not in it as the surgeon or the doctor who is seeing patients. So that is a very important first distinction. Lead generation is something you do with your business hat on. And as I said, it's not a taboo topic. It's not something to have awkwardness around. As a doctor in private practice, there is a business reality. You do run your practice with the overhead costs. You have staff, you have rent to pay and commodities to pay for, utilities. So it's a reality that you do look at your numbers. So how can you build a strong lead generation engine, as I like to call it? Well, there's a couple of things, and the big question is always, should we just advertise or not? Now, there's an ethical thing. As a doctor, you may feel that advertising is not for you. And there's regulations. And depending on the area where you work and the jurisdiction, there is probably a legal framework that details what you can do and what you cannot do. So there are those aspects. Now, of course, why would you advertise? So it's good to take a step back and think about the purpose of advertising or marketing, which is what we'll talk about in a second. Well, the big choice, and it really boils down to that fundamental choice that you have, do you want to be visible? Or do you want to just keep doing what you're doing, just based on word of mouth referrals or general practitioner referrals, and then see other surgeons or other specialists build this massive online visibility and become leaders and become maybe more successful, maybe get more patient leads? So that is the big question. Why would you start looking into your visibility? Well, the answer is very simple, because you don't want to be invisible. You don't want all the patients all of a sudden to go somewhere else, even if that is a long-term process. Now, content pages. That is a big thing. Here at Digital Practice, we pride ourselves in having developed a methodology around content for your website. Remember, your website, you might look at it and go, well, do I really need it? Do I actually get patients from it? Well, our customers and the leading doctors we work with do actually see the impact of quality content pages on their website, covering specific topics that patients are Googling for. Because that's what it's all about. Content pages are an answer to what the patient types into Google. And this is not a matter of just quickly putting some content on a page. Every single content page we co-produce with our customers is a specific answer to questions that patients have. And that is why those pages create visibility. So wherever the patient is in their journey, Googling first symptoms, all the way through to having received a referral, maybe to a colleague of yours, well, your website, your content page can make a difference, because you can hook them, get their attention, offer really valuable, accurate patient education content, and just gain a new patient, because the patient might change the destination of the referral and come to you, not to the competitor. So this is how it works. Can you see how great content pages based on strategic information that obviously we collect with data, these pages can make a massive difference in your healthcare lead generation. So how do you start? Well, you put the content in place and then you spread the word. And one of the methods we use and one of the tactics we recommend and we implement with our customers is to set up a blog. So you've got your content in place, and then every now and then you add new content, blogging on your website, on LinkedIn, and combining that force. So you spread the word. And this is actually amplifying word of mouth. If you're big on traditional word of mouth and you like that as a referral source, well, think of it as the digital equivalent. You're now spreading the word. You're just using technology to give people something to share. If a friend or a family member has a complaint or a health concern, well, then they've got a link in their phone they can quickly share. This is how digital content marketing works. So it's not a taboo. It's not awkward. We can help you. If you have questions, we can answer some of them in a complimentary, obligation-free strategy session. And then if we take it further, we can help you build strong content so you become a leader in your field on the digital space, and actually generate more leads. If that sounds great, book your free strategy session, and I look forward to speaking to you soon.